So Dr. Gervasio came to me. He's a podiatrist in the area, a very busy practice. He had a rotator cuff tear. Dr. Joe had done everything he could not to have surgery, which is completely understandable. You know, if you had told me as an orthopedic surgeon, okay, you need to take a month or two off from your practice to get your shoulder fixed, it's how do you do that? How do you take that time? So he had done physical therapy, injections, he even did acupuncture, just hoping to deal with his pain. But he had significant pain affecting his activities of daily living. He had significant pain at night. So we did an arthroscopic rotator cuff repair. As part of that, I did bone marrow stimulation, which is a technique to help stimulate the tendon to heal by drilling very small holes in the bone to help stimulate the tendon to heal, which has been shown to have a 50% improvement compared to not doing it that way. And on top of that, afterwards, we used a bunch of pharmacologic agents to help stimulate his tendon to heal, including vitamin C, vitamin D, and an antibiotic. There's one antibiotic that's been shown in the literature that improves tendon healing. There's multiple studies in animals that show that. And there's even a human study that shows that patients that took that antibiotic for a month after surgery were stronger a year out after rotator cuff repair than patients that didn't. So Dr. Joe did very good. He's back in practice. He's now 9 months out from his surgery, has no pain, and is wondering why he waited so long.